Welcome everybody, yeah? Basically we're here and we're protesting against the use of electroconvulsive therapy, sometimes known as electroshock, in the NHS.
Inject him with anaesthetic to knock him out, and then we're going to inject him with what they call a muscle relaxant, but it's actually paralysing. So we're going to paralyse his body so he can't even breathe, and so he has to be given oxygen by hand. Someone has to breathe for him. But sometimes the doctor gets it the wrong way around and puts the paralysing in first before the anaesthetic, so the patient can't breathe, they're totally paralysed and they can't tell anyone and they're suffocating before they then knock them out. So that's very frightening. That has happened to people and they remember it. So then once he's out, we then put on the electrodes and send 400 volts through his head for about 8 seconds. And then we obviously put a mouth guard in first because his teeth will clench, even though the rest of the body's paralysed. The teeth will clench and can break them, even with the mouth guard in place. So then Teddy, in the old days, without the paralysing agent, he would shake a lot. Because he's had the paralysing agent, break limbs and everything, because he's been paralysed, he will still shake a bit. So there will be a little bit of a tremor, and also they would have put a cuff onto his arm or his foot so that that wouldn't get the paralysing agent and then would curl up. And the doctor will then be looking at the printout to make sure he's had a fit, and if he hasn't, they'll just put more electricity in until he does. And then when he comes round, he is going to be very confused for a few minutes or even a few hours. He won't even know who he is, what he is, anything. Be very distressed, have a terrible headache, and will not be allowed to drive for a long time while he's having the treatments or sign any documents, and yet they'll still let him sign a consent form for the next ECT round if he wants it.
Electroshock therapy, my friend, a device that combines the best features of the sleeping pill, the electric chair, and the torture rack. You kidding me?
Hell no.
They strap you to a table. You're touched on each side of the head with wires. Zap! Punishment and therapy in one shocking package.
I thought electric shocks is torture.
Torture.
I can't see how it possibly does any good whatsoever.
Mm-hmm.
Like, the brain is really delicate, it's just full of nerves and electric impulses, and you then need to just put a load of electricity through it in a very...
I've been protesting against this stuff, or campaigning against it for about 30 years. And I think, well, why is this stuff still around? Why is it being used? It's as horrendous as it ever was. Why are they still using it? You know? I'd update my knowledge. So I went to a library a few days ago and I discovered a book which is pro-ECT called Electroshock History by David Healy and Edward Shorter. Yeah? And I started reading it. It's so full of contradictions and it ignores the evidence, etc., etc. But I'm just going to put that aside for now. And I'm going to say, yes, that there is an enormous amount of research done, basically, which shows brain damage, memory loss, mental dysfunction, It's kind of written about in a whole lot of books. You can find out about it on the internet. But it's actually unnecessary to be familiar with all that, because actually what I want to talk about now is just a little bit of common sense. That's all it is, yeah? You don't, even if none of that research had been done, ECT would still be a scandal, yeah? Basically, all I want to say is, okay, communication in the brain, we know that it's kind of electrical, that's kind of more of a metaphor than anything else. It's not the same, and please don't compare it to electricity flowing through wires. It's a much more complicated process, complicated kind of physiological process. And, you know, basically cells in biology are not things which are designed to have electricity pass through them. They cause a whole cascade of biochemical reactions which are not designed for, and ultimately they kill the cell. What is it about brains and minds and so on? Well, one thing is, if you think about it, basically everything that goes on electrically, physiologically in the brain is organised, yeah? Like, that thing there is not a table, yeah? That's Parliament, yeah? This stuff here is not, I don't know, a railway train, it's grass, yeah? Things are very definite, they're one thing or the other, yeah? And basically, so you've got a kind of incredibly complex organisation of thought in terms of physical processes, etc., yeah? And then basically you plug somebody into the grid, which is what ECT is, yeah? Now basically you can have conversations. I can talk to you now, you can have some kind of vague understanding of what I'm going on about, it kind of makes sense, yeah? There's an awful lot of physiology and biochemistry going on there. Yeah? What is it about brains and minds and so on? Well, one thing is, if you think about it, basically everything that goes on electrically, physiologically in the brain is organised, yeah? Like, that thing there is not a table, yeah? That's Parliament, yeah? This stuff here is not, I don't know, a railway train, it's grass, yeah? Things are very definite, they're one thing or the other, yeah? And basically, so you've got a kind of incredibly complex organisation of thought in terms of physical processes, etc., yeah? And then basically you plug somebody into the grid, which is what ECT is, yeah? Now basically you can have conversations. I can talk to you now, you can have some kind of vague understanding of what I'm going on about, it kind of makes sense, yeah? There's an awful lot of physiology and biochemistry going on there, yeah? But have you ever had any good conversations recently with electrical generators, for example, yeah? Or, you know, kind of, or sockets or whatever? It doesn't happen, yeah? So basically what's happening is that you've got this electricity from the grid going into your brain, going through cells, and it randomizes, yeah? Quite apart from anything else, it randomizes information, it kills cells, it does all kinds of shit, yeah? It can't possibly do anything good for the brain, yeah? And basically it leaves people with horrendous problems. But there was a chapter in this book, the book I've already referred to, which is called ECT Does Not Create Zombies, or something like that. And actually, that's true. It doesn't create zombies, yeah? But I've loads of friends who've had ECT. Some have had a little bit of ECT, some have had lots and lots of ECT, yeah? And if you have a little bit of ECT, it ain't good for you. You're not going to be a happy bunny, although I'll come back to that. But basically, most of your memory is still going to be intact, most of your mental function is going to be intact. If you have a lot, and I hope he doesn't mind this, I'm going to use somebody's name here, you can actually look him up and look at him on YouTube, is an old friend of mine called Frank Bangay, yeah? Who's one of the most wonderful human beings I've ever come across. Psychiatric survivor, he's had shitloads of everything done to him, and he's a poet. You find something called survivor's poetry. And he's a beautiful, beautiful man, yeah? And it shines forth from him, but you can also see the damage is visible, yeah? His coordination is good, his speech is a bit slurred, finds difficulty sometimes putting things together. He's a beautiful person and they're trying to get out, but it's part of the mechanism for getting out has been smashed, yeah? Lots of people like that, yeah? People talk about the efficacy of ECT, and I always like to say, thank goodness it doesn't work too well, yeah? Because basically it's about dealing with somebody in distress. Instead of giving them a hug, or listening to them, or talking to them, or what the fuck is going on, etc., etc., and trying to communicate with them, kind of like, you know, a load of electricity. And when people come out of that, one of the confusing things is that sometimes they can be euphoric. Sometimes they can be in a high. Sometimes, this ECT, it's wonderful for 1 month, 2 months, or whatever. But it doesn't last. And the reason for that euphoria, the reason for that high, and it doesn't happen every time, it only sometimes happens, by the way, is that one of the common effects of brain damage, which is how CCT works, is euphoria, is to have a high for a while. It's a well-known effect of brain damage, so I just think this stuff is absolutely disgusting, and basically it should have been stopped an awful long time ago. Dan, who's making this video, has just asked me the question, which in a kind of a way I've dealt with slightly already, but basically what happens if people receive ECT and think it did them a world of good? I'm going to go back to the Mind Conference many years ago, and I gave a kind of speech against ECT, and which is very well received. This is not the Mind Conference, actually, Mind AGM, National Mind AGM, and it was very well received. And then immediately after I sat down, somebody who'd had ECT got up and said precisely it had done them the world of good. And people were a bit embarrassed, because I think most people there kind of supported what I was saying, But I thought, brilliant, I'm really glad this guy has had the courage to do this, the courage to stand up, challenge me, to say this kind of publicly. I thought, brilliant, that's her experience. I completely disagree with him. But I think I'm really glad that he actually, misguided who, that's all, kind of, who knows, maybe I'm misguided, But basically I wanted to say, I was talking earlier about brain injury and all the terrible effects actually of memory loss, etc., But let's say none of that actually happened. Let's say there's no research showing that there's anything wrong with ACT, there was no visible memory loss, there was no mental dysfunction, etc., Still, you have a situation, that here is a human being in a lot of distress. Might be very low, might be freaked out, confused, running around, all kinds of crazy ideas. But that person is a human being, and what's going on in their head, however bad it is and however terrible it is, that's part of them, that's part of their life experience. It's who they are as a human being, and so you want to respond and help that person and kind of take their part and listen to them or give them a cuddle or whatever else. But if you have something that you come along and you think, well, we're going to change their brain so that they're a happy bunny. And you could do that with everybody who's unhappy in the world. And you could plug them into the grid, or you could do whatever. And you change their brains and suddenly, hey, I'm so happy. Is that person still human? Have you actually denied that person's humanity? Instead of actually dealing with real issues in their lives, I think that's the case. So that's my answer to your question, Sharon.
Well, from what you just said, I would say if you're altering someone's self-identity, is that a good thing? Because I would say, well, no. So, but also from what you're saying about their humanity, but if what has happened is they're feeling better because their brain has been damaged,
yes,
I would question the ethics.
Well, exactly, there are no ethics. The doctor is confronted with somebody who's really confused, and they're in that medical context, and they know what they're supposed to do. And how many psychiatrists, and there are exceptions, I've got to say, there's some wonderful exceptions, but how many psychiatrists do you know that have the empathy to connect with somebody when they're in a very confused, freaked out state? I've actually seen, I remember once in Maudsley emergency clinic, of all places, being in there with a friend who kind of was coming, she was under a police section, and I kind of accompanied her, and I was completely opposed to it, but I was just being there as a friend. And at one stage, one of the psychiatrists who came in to see her, I wish I could kind of imitate, basically came in and was ever so sensitive. And basically really approached her in such a sensitive way, and just sat down at the end of the seat from her and talked very, very gently to her, on a very equal footing, and was a really lovely person and a really nice person. And I wish every psychiatrist was like that. I was flabbergasted. I was watching this woman, I was like, wow, I could learn from this. And I thought this is astonishing. But unfortunately, psychiatrists like that are not. They're very exceptional. And in fact, there was a second psychiatrist with this particular case, and basically he had a white coat and a clipboard, and he was asking her clipboard type questions to somebody who's completely in a state, completely freaked out, and dealing with her in a completely robotic way. And she came running out of the room.
Trying to look at what symptoms he can diagnose.
Exactly. She came running out of the room, and basically very angry, and she's quite small, so high, he's quite big, and he was kind of chasing behind her with this clipboard, and she hit him a kind of glancing bow like that, just kind of get away from me. And then he basically said, well look, she's dangerous, kind of like she assaults people. What? This is like something absolutely tiny. So within about 5 minutes later, he had these nurses assembled. I was here, she was here, and there were these nurses kind of around us. And the nurses looked completely pissed off, and they looked as though they thought the whole thing was idiotic, which it was. And I was effectively trying to keep them at bay. Now afterwards, I don't remember exactly what happened, but basically afterwards what happened was one of these nurses and I, we had a conversation. And I said to this nurse, this is kind of in a private conversation, I said to them, kind of look, I know you can't say anything, but that guy is an imbecile, And he looked straight at me, and he said, I'm afraid I can't really comment on that, but he's an imbecile.
I'm Parker, and I joined ECT Anonymous, I can't remember how long ago, probably about 20 years ago, I think. May have been longer, I'm not sure. And I answer the phone to people who are inquiring about electric shock treatment. I've been campaigning against it in different situations, really over the years. I've been talking about it ever since it happened to me.
Because of what happened?
Because of what happened, and because I think that it's so, it has been so misrepresented as a good thing, when actually for some people it's devastating, absolutely devastating. I felt like an empty shell afterwards. And so that's why I decided that when someone was needed to take on answering the phone, I would do it, and I continued to do that.
And it affected your memory then?
It affected my memory, as particularly I have difficulty recognising faces since I had ECT. It takes me a long time to learn a new face, and if I see someone after a long time, a long gap, I sometimes can't remember that I've met them before.
Are there bits of your past you
Sorry?
don't remember? It's a bit noisy.
Yeah.
Are there bits of your past you've forgotten?
It's hard to know what bits one's forgotten,
I see,
basically.
yeah. Well, some people, it seems, realise that they cannot connect to their past anymore.
That's right. Some people have lost. I've had lots of people tell me the things that have happened to them, and that has included things like they can see themselves in photographs of weddings and christenings, but they've no memories at all of them. Somebody I knew of that I have met was a taxi driver, and she was unable to work anymore because she couldn't remember the routes. Someone else was a teacher and was unable to use the dictionary any longer and found her handwriting was...
I've heard stories like that. Yeah, people had a lot of skill and were working, had ECT, and they can't remember how to do what they were doing before.
Yes.
So literally their lives then can't carry on as before.
So the whole system is wrong, and it puts drugs and in ECT when it should be care about the person. And one of the things that can be really helpful is if people are listened to, and if they're allowed to do the crying they need to do, and the laughing they need to do, and the shaking when they're scared, and nobody trying to stop them. Those are the things that are recovery ways of recovering. They're natural ways of recovering from things that have happened to us. And it's really helpful to have that kind of support from others. And ordinary people can be very helpful to one another in that way.
What the doctors do is if people feel like crying and shouting and screaming, they say it's because they're ill.
Yes, and that was why in the second series I was treated with ECT, because I was found crying. I knew that I was feeling better, but the pressure to do what I was told, which is one of the effects that can happen when you've had ECT. You become more passive, and that's what had happened to me. And so even though I was actually I'd actually been out of hospital for a bit, and then began to feel worse, and I think that was the result of the ECT. When I went back and then I cried, that's when they pushed and pushed until I was treated with ECT again.
That's ridiculous in my mind. The minute someone starts expressing any emotion, which is natural and normal, they just, shows how ill you are. But to then say someone has to have ECT it's because
medicalising something that is actually a natural recovery process.
Oh no. So you had to have a second lot then?
Yes.
And how did you feel after that then?
Well, I'd already felt like an empty shell before that, so I didn't feel any better. It took me a long time to recover from that.
Did you give your consent to have it?
The second time I had. The first time I wasn't considered fit to give consent, and at that time, it was a relative could give consent, and that had been a case of pushing. Telling my husband that I would never be normal again if I couldn't be treated with ECT. I explained to them that the surveys that were done in the late 1990s were they were done by ECT Anonymous at the time, and Mind and the United Kingdom Advocacy Network, and in each survey it was found that about a third of the people felt that it had been helpful, a third felt that it had damaged them, and a third felt that it was neither helpful nor unhelpful. It was just not much use to them. The thing that is so difficult is that there's such pressure, both from inside someone who's being treated, because they're feeling so bad in some way, and then this is presented often as if it's the only thing or the last thing or the best thing that can be done, and it doesn't really work as well as the claims make it. I'm still at the end of a phone. Okay, it doesn't. People don't ring very often now, but I do hear from people. People can be helped, and I don't think that anyone should be given ECT unless they have said that they want to have it, not being pressured, as so often has happened to people. Therapeutic treatment. That's therapeutic is allowing people to have their feelings and to be listened to and to be accepted for who they are.
And for them to accept how they feel too, in a way.
Sorry?
For them to be able to accept how they feel.
Yes.
Rather than being told that they're symptoms of an illness.
Yes.
That's how that's how I see it.
Being able to accept that it's okay to cry. Because part of the trouble is that the society we live in tells people that it's not okay to cry. And you can see that when children come to school, especially little boys, when they're hurt, that they sort of stiffen up and you can see that they've already absorbed this thing about you mustn't cry, and that's a bad thing. Twinkle, twinkle, ECT, you will never more get me, never buzz inside my brain, nor make me forget again. With the allies you can be, we can outlaw ECT.
The author of a scathing research paper into the treatment says it's outdated, dangerous, and only effective in the very short term.
What happens is that it's a little bit like charging up a rundown car battery, to be crude. It's not difficult to get artificial changes in the brain. You could do it with cocaine. It's not difficult. That doesn't last, of course. And then you find 3-4 weeks later the person is either back at the same level of depression, or many studies show even worse levels of depression. And then, of course, some of those people think, I felt really good right after the ECT, give me another one. And then they get into this endless cycle, and it is perhaps a form of addiction. It's not in any way addressing the cause of their depression. It's systematically and gradually wiping out their memory and their cognitive function at the same time.
My name is David Taylor. I come here from Scotland. I'm actually actively participating in Speak Out Against Psychiatry group, and I find it an incredible, helpful group. I'm actually subject to a compulsory treatment order, which means I am actually forced medication against my will. For the past 3 weeks I have refused medication despite the fact that I am on a CTO, and I am actually feeling a world of benefit through doing so, even though I'm having to cope with some horrendous withdrawal symptoms. Being reported by psychiatrists to be originally schizophrenic. Now I'm diagnosed with something called schizoaffective disorder. These disorders are somewhat meaningless. I don't identify with any symptoms of them whatsoever. Perhaps I have some mental health issues, but doesn't everyone at times? There is no reason to compel someone to take a horrendously damaging psychotropic drug which interferes with neurotransmitters within the brain and, in my opinion, are worse than street drugs. Would you pin someone down on a routine basis and inject them with heroin? It's with hospital admissions. I've met various people who have been treated in various different ways, none of which are beneficial, and with electroconvulsive therapy, I mainly noticed they seem to be almost permanently in the hospital. They suffer horrendous sets of memory loss, and they barely recognise who they are. And to begin with, some of them actually just after it can get the euphoria, sense of euphoria type thing, and they somewhat like it a bit. But the repercussions of it, of the brain damage and the memory loss, most significantly the memory loss, I notice with them, and the fact that they're the people that don't get out of those hospitals and are in there for long periods of times and constant relapse. That has no benefit whatsoever, other than a very, very short time, and that's through experience of meeting people who are routinely electroshocked. Just on Tuesday actually, and we've got to change whatever it is that I'm on. I don't know how much negotiation he's prepared to do, and whether he would even allow me to take a more holistic approach to mental health issue, where I'll be more in control of myself and have a better view to dealing with my issues that some people don't like, I suppose. If I have behavioural issues, I'm sorry. I mean, I don't think any of this is my fault. Sad thing is, one of the criteria for a detention in a hospital is risk. Yeah. That person has to be a risk to themselves or others. Mm-hmm. And I have never been a risk to myself or others whilst off the medication. I completely disagree with their statements there. I don't know here, as I stand here, I'm off medication. Fair enough, I'm kind of more vocal than I used to be, which is a sudden change of brain state from someone who, while on medication, said nothing, and all of a sudden is outbursting with all this anti-psychiatry stuff. But I totally believe that people should be in control of their lives, and particularly their health issues, and have the right to make an informed decision on their care in practice, especially if someone is informed on particular treatments and alternatives as well as I am. And it should not be dictated by psychiatrists who want to use damaging drugs, damaging ECT, and lock people up in mental institutions which actually have no... It has the complete wrong environment to promote any sort of recovery whatsoever. It's like a farm. They farm people to make profit out of them by diagnosing them with mental illness. It is my opinion that forced treatment is the most unhelpful method of treatment possible. I mean, that includes electroconvulsive treatment or psychotropic drugs or anything that is forced upon against the will of the person. It is shocking, and in my view is complete medical tyranny, where they're completely disregarding the right to informed consent. They say people lack capacity when they don't. It is completely dictated by psychiatrists, and they can do whatever they want because of their PhD in psychiatry, where they
might not even have a PhD. I'm sure a lot of them aren't that qualified.
Sure, it completely destroys your motivation, your charisma, your whatnot. I mean, I'm gaining some of it back now from actually stopping it and actually taking a stance by coming down to London from Scotland, just because I was part of this group, and I found it an amazing outlet to speak out about my frustrations with psychiatry. It's something that's plagued me for 7 years, and for 7 years I have disputed my diagnosis. Yet no one will listen to me, no one will lawyers just get other psychiatrists, and you're stuck with the profession of psychiatry, whose job it is to label someone.
ECD, which is given more and more in this country every day, each day, every working day, ECT is being used. ECT is given, if you don't sign, you haven't got capacity. If you've signed, you've signed. Very much like the 17th century witch hunts. If you burnt, you weren't a witch, but you were dead anyway. It's got to be stopped. It's got to be stopped now. It'll be too late if you don't do something about it, say something about it, make a stand. It could happen to you.
I felt I had brain damage.
Yeah?
I wanted to die afterwards.
How many times did they give you?
Only 6.
When you talk about ECT, electroshock therapy, people say, "Oh no, we don't do that anymore." And there's a common conception we do not give ECT anymore in this country, but we do. And I've met quite a few people who've been given ECT treatment, and I've even met someone who was given it without their consent. The person was refusing to have the treatment, but they were still taken off to the ECT room, knocked out unconscious, and had electricity run through the brain. And the reason they did it, even though the person was saying no, is because there's a loophole in the law where basically if they argue the person doesn't have the capacity to understand that the treatment is helpful or it's a medical treatment, then they can give it